In 2000, I was diagnosed with Crohn's disease. My daughter was 9 months old when I started showing symptoms and attended my doctor. By the time she was 12 months old, I had a diagnosis of a lifelong condition. For the 13 years up to the surgery, I experienced numerous reactions to the drug therapies that were on offer. Eating caused my bowel to become so enraged and so disgruntled that I couldn't eat. The combination of being so severely malnourished and the peritonitis that I experienced resulted in emergency surgery and the formation of a stoma. I was in hospital for a month and I left hospital with a fistula, but I was not aware of the fact it was a fistula. I thought it was a bed sore because I'd been so poorly. I wasn't informed or didn't find out until 3 years later, at which point I was very poorly as a result of the fistulas being allowed to reign without treatment. I had a Planseton procedure planned. However, 3 days prior to that, I realised that I was experiencing very intense fever symptoms and I had to attend A&E. I was admitted on the Saturday as an emergency because I'd had an abscess that had formed around a previous seton and had caused me so many issues that I'd ended up with a significant infection. So of course I was dealt with as an emergency. So I had an abscess drainage. They didn't actually do another seton, they just lanced the previous site of the track, hoping that that would clear up. Fistulizing Crohn's disease has affected my quality of life in a significant way. It can affect my skin, it affects my nutrition levels, it affects my heart, it affects my breathing, and it affects my general function. I've experienced suicidal thoughts, depressive thoughts, fears around never having a life again, a sense of loss of identity. I've been taken out of the workplace, I've lost my home. All these things have impacted me emotionally. The other thing about Crohn's disease is when I'm generally well, I don't look ill. So I don't really get an awful lot of understanding or sympathy or appreciation that I'm not able to perform as people would expect me to be able to, just by the way that I look. So I end up with an awful lot of judgment. People react very, very quickly to the way in which you sit. And I find, obviously, as a result of the pain, that I am not able to sit upright or sit flat onto my bottom. So I always instinctively move to my hip and cross my legs to keep my bottom from contact. I also experience people insisting that I sit down because I will obviously stand some of the points and I will fidget in my seat. The power dynamic between two individuals in a situation where one is sitting provocatively or one is standing whilst the other is sitting changes my interpersonal relationships with people. Today, my philosophy has been very much to seek isolation. Isolation enables me to manage my own temperament. I've found that it's been a very reductive way to deal with the stresses and the strains of having an active life because of the rage I experience with the level of discrimination and judgment and preconceived ideas of what people think you should be or shouldn't be able to do. The one thing I do have, and I have had to come to terms with, is the fact that I will always have to have my health as the priority. Everything else becomes secondary.